Uh, Hello everybody, in this video we will speak about the part 1 of the follow-up. Uh, it would be great if the patient came to the follow-up and objectively described the changes after the remedy. However, the problem is that the patients often underestimate the effect of the essences. Why? Well, one reason may be because the patient doesn't trust the method. In my personal practice, I often use Bach flower essences in patients that have never heard about them. And the reason why they came to the therapy is that the classical medicine didn't help them. And that is why they tried just because I have recommended to them, but they do not know what it is and what effect they should expect. Or maybe the patient has expected a faster or different effect. Maybe he neglects minor changes and attributes them to some other influence like change of diet, some food supplement, or just change of weather, or because the boss is more pleasant now. They may also be fixed on a local problem and they neglect a change in some other area that might be more important. Or maybe they hope that when they report no or minimal effect to you, they will make you change the therapy, give them something stronger. Or maybe they have a fear that if they admit that they feel better, you will terminate the therapy. Uh, in the last video, we have spoken about the cycle of change. If you haven't seen this video yet, there is a link below the video. And the change, or especially significant change, usually doesn't go in a linear way, but it goes in a cycle. So there is some patient's confidence, self-confidence, confidence in his resources, confidence that he can succeed, or confidence in the therapy, and then some motivation comes, either positive or negative, and then the patient invests some energy into the change, then he makes an attempt, and then the result influences back his confidence. So if the result is positive, his confidence grows. If the result is negative, his confidence is lower and lower. And we have some tools how to influence this cycle of change. Of course, we can use the essences, but apart from these essences, we can also use our words, our communication techniques. For example, we can boost patient's self-confidence, help him to become aware of his resources, to boost his hope and to boost his confidence in the therapy. We can also reframe the motivation. So it means reframing means change the interpretation, for example, from being a problem to a challenge that allows him to grow personally. Or we can appreciate the investment. The bigger investment is, the bigger the chance of success is. And we can boost his courage, and we can also reframe results. What the patient interprets as a failure and feels, for example, guilty because of that, we can interpret that it is an experience, and next time he will be more, there is a higher chance of success. So, how are the tasks of the therapist during the follow-up? First of all, it's boosting of patients' hope, self-confidence, and confidence in the therapy. It's the most important task, and if you fail in that, so the success of the therapy is improbable. Then you also should appreciate the investment, or reframe the motivation, boost the courage, and reframe results, as we have spoken in the previous slide. Or the task of the therapist is to adjust the remedy combination if necessary, but as you can see, it's not a primary task. If the patient's hope and self-confidence and confidence in the therapy is low, or there is no hope or no confidence, so any adjustment of the remedy combination probably won't bring any effect. And finally, if everything all fails, sometimes if the patient is irresponsive to the remedy, or he reacts slowly, so maybe your task may be to gain some time. And what techniques you can use during the follow-up? Of course, you can use reflections, affirmations, open questions, summaries. You can compare extremes. You can use some quantifications or scale or reframe. If you haven't seen the videos about the communication techniques yet, please click on the link below the video. And the most important is to concentrate on positives. Even when you personally have some doubts about the result of the therapy, do not share your doubts with your patient. That's the difference between the first consultation and the follow-up. During the first consultation, you need the most objective, the most wide description of patient's feelings, how he feels guilty, how he feels panicky, for example. But during the follow-up, you already support the change, so you concentrate on the positives. Imagine a patient that has come to the follow-up and he is mostly pessimistic and disappointed by the therapy. Yes, there are some positive parts, but he concentrates mainly on the negative, where there is no change, or there might be even something worse. And if you, during the consultation, concentrate, or your dialogue, your conversation concentrates on this positive part, and maybe most of the consultation you will speak about the positives, it's quite possible that the patient will leave your consulting room much more optimistic and hopeful as for the result of the therapy, and he will trust the therapy. The reason is that from a psychological point of view, the more you speak about something in a positive way, the higher is the chance that you will expect the positive in the future. So let's start with the first technique. It's simple reflection. Simple reflection just means to repeat some part of the sentence of the patient in his words or in your own words. And of course, we should concentrate on the positive part. And the sentences of our patients are often partly positive and partly negative. So we will use the simple reflection to reflect the positive part. So the patient comes and tells you, sometimes it seemed that the headaches were less intense, but the last week it was terrible. So you can reflect, there were moments when the headache seemed to be less intense. My self-confidence is still very low. I finally agreed to do this presentation, but the fear was terrible and my hands trembled. So you, of course, will reflect the part when he agreed with the presentation and he did it, really. So it's very important. So you were able to do the presentation. Or you can, sometimes there is an ambivalence, like in previous sentences, there is some positive and negative, and the patient hesitates inwardly between these two options. And if you stress only the positive, the result may be that he starts to defend the negative part. To avoid this, you can use two-sided reflections. Like, sometimes it seemed that the headaches were less intense, but the last week it was terrible. And you can use two-sided reflection. Last week wasn't good, and before that there had been moments when it seemed better. Or, my self-confidence is still very low. I finally agreed to do this presentation, but the fear was terrible and my hands trembled. So, on one hand, you had a fear and your hands trembled. On the other hand, you did the presentation successfully. So if you remember, the principle of two-sided reflection is to avoid the conjunction but. Instead you will use and, or on one hand, on the other hand. And the part you want to develop further, you put to the latter place. So there are both parts, negative and positive, and you put the positive as the next one. And you can also use amplified reflections. Amplified reflections are used when the patient speaks about something as bad and the same and no change, and you can use the amplified reflection to provoke him. The headache is the same. There was absolutely no change in the frequency and intensity of the headache. It is the same every day. So in some patients, they may react, okay, there were some slight fluctuations, some small changes. And you can start to discuss about these small changes. Or my self-confidence is still very low. And you can reflect, there was absolutely no change in your self-confidence. Again, you provoke the patient to change his mind, to admit that there was at least some minimal change. And you can also use weekend reflections. For example, the patient comes and he is really desperate because he describes a conflict with the father, and the conflict with the father was really terrible. We yelled at each other and I felt hopeless. It is all the time the same. So it sounds very pessimistic. And the weekend reflection reduces the emotional charge of the sentence. So you can react, you had another unpleasant conflict with your father. So you used unpleasant instead of terrible and instead of hopeless. So let's summarize the communication techniques used during follow-up. The most important is to concentrate on positives. And we have spoken in this video about reflections. So you have simple reflections, and in the simple reflection you can move the focus of the attention to the positive part. With two-sided reflection, you deal with patient's ambivalence. He speaks about something positive and something negative. So you reflect both parts, but concentrate on the positive one. You can also use amplified reflection when the patient tells that everything is the same and everything is bad, and you can provoke him to reveal that there is at least something positive. And you can also use weakened reflections when there is too much emotional charge, especially negative emotional charge, that might hinder in the consultation. And in the next video we will speak about affirmations, open questions, summaries, comparing extremes using quantification or scales, and reframing. So, thank you very much for watching this video. I hope you have enjoyed it. And in the next video, we will continue with the follow-up, part 2.